does she necessarily pass it on to her child?
No.
Okay.
If she is doing treatment and has been treated, it's very unlikely that she would pass to baby.
Okay.
Even the only kind of way is they can pass through breast milk though as well, which again, with all the education that goes on now, and usually there's very close kind of like tracking and assistance with those folks. They have like a caseworker or a social worker, someone working with them to make sure that they're getting access to their meds, they're taking their meds, kind of know all of the things that they can do to make sure that they don't pass to baby. So it would be very unlikely that someone who is pregnant or had a baby is then going to be breastfeeding their baby, because of course we wouldn't want them to pass HIV to them. So with that treatment, they're not going to pass while baby's inside, and they won't pass it through like childbirth. So again, the only way then afterwards would be through breast milk. But again, with the education, people aren't taking that route. So I think it's like in the last 5 years, there's maybe been one baby born with HIV in the state of Wisconsin. And that's kind of how the records or like trends are showing across the US too. Just got a really good, with practices of people are getting prenatal care, those people are getting tested right away. As soon as they find out they're pregnant, they're getting kind of tested for all these things to make sure that if there is something they need to be treated for, that's getting started right away to try to reduce that risk later on. Yeah.
Is it true that it's less likely to give HIV to the baby if you give birth with a C-section instead of naturally?
No, because if they're taking that medication, that's really what's stopping it. So if someone's not taking that medication, it's more likely that that HIV is passing while baby's in utero or in the womb, because mom and baby are sharing blood, and that's how it's going to pass between, versus something like chlamydia and gonorrhea. If someone had that and they weren't treated for it, then during a vaginal birth, they're getting exposed to those vaginal fluids which hold that bacteria, versus if they came out via C-section, they're not passing through where that infection is. So for like chlamydia, gonorrhea, a C-section would kind of eliminate that. Of course, we'd rather just treat, and then they could have baby either way, but that would eliminate that. Versus HIV, it's more of that blood kind of passing between mom and baby that's passing it, versus like the birthing process. So that in that instance, it wouldn't matter which way they were delivering with HIV. It's more that medication that they have to have versus how they come out. Did that answer? I feel like I just kind of talked in a circle for a second. Okay, thanks. Any other questions on anything? Okay, well, I hope this was helpful. A little background of things, and if any other questions pop up, Kurt has my info, so feel free to send stuff over if you have it, but that was informative for you all.
Does your business or the health service, do they allow explosive product things, shadowing or anything like that? Because of the names?
I would say like preceptorships would probably work, because I mean you would be going through training, and you would be signing forms that you're going to keep things confidential, all of that, so you'd be held to that same standard. Would probably be more likely than like just shadowing for like a day sort of a thing. But if it was going to be for like a semester long kind of thing, or depending on I guess what it is, maybe for a day. But this role specifically, or just I guess kind of anything around STIs, if you're working with patients, might be a little more difficult. Yeah, for that exact reason. It's just trying to keep things as confidential and being as sensitive to that as possible. But I would think more of like a preceptorship. They do things like that, and then they just kind of go through the training and understand the confidentiality piece while they're in there.
All right.
Any other questions? You're good?
Thank you.